Hi guys, hope you are all well. This is Ulas. Today we'll be studying the intermuscular spaces of the scapular region. Okay guys, let's get started. Guys, see here, I have a representation of the posterior aspect of this region, mainly the shoulder joint and the back of scapula. Okay, see here, this is the scapula. This is the humerus. This bone is the humerus. And see here, we can see three muscles here. Which are they? This is the teres major. This here is the teres minor. And this here is the long head of triceps. Okay, guys, see here. Here we will understand a very interesting concept. See here, the teres major muscle is taking origin from the posterior aspect of the near the inferior angle of the scapula. Okay, then it is going and attaching to the medial lip of the bicipital groove. What was attached to the lateral lip? Lateral lip, there was the attachment of pectoralis major muscle. So see here, it is going from the back side to the front side. The bicipital groove is in the front. So if it is going from back to the front, if it contracts like this, will the arm rotate medially or laterally? It will rotate medially now. So the action of the teres major is medial rotation of the shoulder joint. Then there is teres minor muscle. Teres minor muscle is taking origin from the lateral aspect of the scapula, lateral border basically, and then it is going and attaching to the greater tubercle. See, lateral aspect of the scapula is here, greater tubercle is here. It is going from scapula, humerus, it is going like this behind and then attaching to the greater tubercle. If that contracts, see, the muscle is like this. If it contracts, will it cause lateral rotation or medial rotation? Obviously it will cause lateral rotation. So the action of teres minor muscle is lateral rotation and the teres major muscle is medial rotation. Got it now? Okay, now let's go to the next muscle, that is the long head of triceps. Long head of triceps, it's taking origin from the infraglenoid tubercle. See here, this is the there's a glenoid cavity here na, you know that, right? The shoulder joint ka glenoid cavity hota hai. So this here is the infraglenoid tubercle. This one, what I am marking here, that is the infraglenoid tubercle. From that there is the origin of long head of triceps. What is the action of triceps? The muscle which you build very well when you do push-ups, that is the extension of elbow joint mainly. Okay, there will be three head of triceps. They join to form the tricipital aponeurosis. Then they attach near the ulna. Okay, near the elbow basically. Okay, now let's go to the spaces. See here, you can see there are three muscles and there are three spaces. See, I'll be marking those spaces in green. Okay, this is the upper triangular space. This is the quadrangular space. Why quadrangular? Because there are four angles in it, four sides basically. And this is the lower triangular space. Okay, guys, this was the representation. Now remember, try to remember this like this. You can remember for long. Make two V's with your hands. Two V's, okay, two V's. Then make it like this. See here. Can you see here? This is the left V. This is one. Okay. See here. This region is the scapula. Scapula. This is the lateral aspect of scapula. And these are two muscles. Which one? Teres major below, minor above. And here, see, this is the humerus. The middle finger of my right hand is the humerus. And this is the long head of triceps. So just join like this. Got it? Oh, join like this. Join like this. Guys, I used to remember this. There are two groups of muscles related to the scapula. Those are the rhomboids and the teres major muscle. Teres muscles. See here. Teres muscles are in the lateral aspect. See, in the medial aspect, there is rhomboid muscle. See here. From inferior angle to the spine, there is rhomboides major, and above it is rhomboides minor. Is it? So the minor is over major. How I used to remember this, guys? Whenever you go to any fest and all, usually people carry their children on the shoulders na. So children is under 18 na, so they are minor. We are major, so we are carrying them na. So minor is over major. I used to remember like this in case of the muscles related to scapula. Okay, now see here, guys. You understood this now? This is how it is arranged. See, I have a photograph here. See the scapula. See, this was the upper triangle space. This was this was the upper triangle space. This is the quadrangular space, and this is the lower triangular space. Got the arrangement now? See, guys, what are the boundaries of the quadrangular space? You can see here there is teres minor above, teres major below. lateral head of triceps medially, and the laterally is the surgical neck of humerus, not the whole humerus, the surgical neck. And the inferior triangular space में क्या देख लो, this is a inferior triangular space. Okay, there is shaft of humerus, shaft. Okay, got it? Okay guys, whatever we have discussed now, let's discuss it pictorially. See here, there are two V's, right? Like this we represented it, na? One V here, one V here. So the first V I'm drawing here like this, and the second V I'll be drawing like this. You got it, na? This was the representation. So this becomes the upper triangular space, this becomes the quadrangular space, and this becomes the lower triangular space, isn't it? Now let's discuss the contents of the spaces. So what are the content, guys? We can remember mnemonics, but one of my teachers taught me the conceptual understanding that I found very effective. I hope you will also find effective. See here, guys, what did we discuss? What was this region, this border? This was the shaft of humerus, isn't it? Shaft of humerus ka posterior aspect. Posterior aspect of the shaft of humerus has a very important groove. This is the groove for some very important structure. That is the radial groove, spiral groove. Okay, spiral groove, radial groove एक ही है. What goes in the radial groove? Radial nerve, isn't it? So the radial nerve is going like this. See here, this is the radial nerve. Then is there something very important? There is an artery there. So artery going there is which one? The deeper artery. That is the profunda brachii, isn't it? The profunda brachii artery. These were the contents of the lower triangular space. Now contents of the quadrangular space. There is one very beautiful nerve going here, which is winding around the surgical neck of the humerus, which is damaged when there is a fracture. That is the axillary nerve. Axillary nerve, isn't it? Axillary nerve. Then along with the axillary nerve, do we have an artery? There is pacha there. Pacha is what? Posterior circumflex humeral artery, isn't it? Then what is the structure of the upper triangular space? Guys, see here. Let's go back to this diagram. Guys, this was the posterior aspect of the scapula. Na? There is one artery going like this. Which is it? The artery is it is anterior to the scapula. So is it suprascapular or subscapular? It is subscapular because we taught now that it is based on the four-legged animal. So which goes above the animal is suprascapular, below the animal is subscapular. So this is the subscapular artery which is anterior. So I am drawing it in dotted line. Just a sec. Yeah. See, this is the artery. So artery is going like this, na? So this is in the behind. So this is in the front. But the artery should, there's something coming behind, na? A branch is coming behind. Which branch is that? That is the circumflex scapular branch. This one. See, it's coming like this anteriorly, and then it passes over the teres minor muscle and then goes to the posterior aspect. That was the structure. See here. You know that, right? This was the teres minor muscle. This was the teres major. This was the teres major. This was the teres minor muscle, isn't it? Abhi dekhna. It goes like this. Dotted, because it's in the front. Then it comes like this. This is the circumflex scapular artery. Okay, those were the contents. Now, what is the clinical importance, guys? Clinical importance ka the thing is, you're finding these spaces, right? It is bound between the muscle and the nerve. So think that there is some muscular mass or hypertrophy of the muscle, abnormal injection of steroids. So ऐसे body build कर रहे हैं ना, if they are injecting synthol in to some muscle there, whether it be long head of triceps or the teres minor or teres major, it will grow, isn't it? If it grows like abnormally, then it can compress on the structures. What are the structures of the quadrangular space? Axillary nerve, है ना? If it compresses on the axillary nerve, what is the axillary nerve supplying? Axillary nerve is supplying the deltoid muscle. So there will be weakness in abduction in that kind of cases, and there can be even trauma. Trauma की वजह से what happens? The spaces are displaced, so the structures will be compressed. So that is the importance. Do you know what is synthol? Synthol is a illegally used drug, we can say. It is a combination of painkillers and alcohol and some oil, and they inject it into the muscle so that they can get abnormal like hypertrophic growth. That disfigures the person completely. Okay, guys, this was today's class. Okay, if you have any doubts, please post it in the comment section. I'd be happy to answer you. Okay, take care, see you, bye.